This podcast is for educational purposes only and does not provide medical advice or create a doctor-patient relationship. Please do not rely solely on this discussion. Always consult your own healthcare provider and verify information independently. If you're in crisis or experiencing a mental health emergency, call 911 or go to your nearest emergency department.
So today on Summit NeuroCare's podcast, I'm really happy to welcome someone many people in Kingston know extremely well, our member of the Provincial Parliament, Ted Su. Now, Ted represents Kingston and the islands at Queen's Park. But for long before politics, he was deeply involved in this community. He spent years working behind the scenes in leadership and economic development roles, bringing people together across municipalities, universities, healthcare, and community organizations to solve real practical problems. Now, most recently, before politics, he served as president and CEO of the Southeastern Ontario Sustainable Energy Association and working closely with local leaders across the region. Now, what stands out about Ted is that he comes into politics with a strong understanding of systems, how education, healthcare, housing, employment, and community well-being are connected. Now, with close ties to Queen's University, Kingston's healthcare community, he's had a front row seat to the pressures facing clinicians, students, families, and vulnerable populations long before these became, daily headlines. So with that, I'd like to really invite Ted to our podcast and try and understand a bit more in terms of the interface between policy and mental health in Kingston, but also the wider region as well.
Yeah, it's good to be here at Summit NeuroCare. You talked about solving problems, and mental health is one of these challenging problems that it's connected to all sorts of different things, like housing, like healthcare overall. This is something important that we should be keeping track of.
So how would you describe, from your vantage point, the current state of mental health in Kingston and the surrounding region?
Well, I think if there's a crisis, it's things like access, wait times, a crisis in those things. But also there's a lot of forces that compound any existing problem. So we've got addictions. So there's some of these opiate drugs have been changing and getting stronger and more dangerous. And then we have an affordability crisis. So there's financial pressure, and that's focused on housing affordability. Housing affordability affects mental health a lot because if people don't have a stable place, I think it's a very large component of stress on people that can prevent them from getting better on their own. And then there's some sort of stealth things that are a bit harder to quantify. The rise of social media and the fact that there are large for-profit interests trying to get people's attention.
Right.
And that is also a stressor. From a policy point of view, the province has something called a roadmap to wellness. It is putting some money into mental health, but it's relying a lot on municipalities and local resources to handle crises, to coordinate. And it's just insufficient. So we'll probably talk about this in the later on in this discussion. But there are a lot of aspects in which it's insufficient, hasn't kept up with inflation, hasn't kept up with population growth, and it hasn't kept up with the acuity, the seriousness and the complexity of mental health challenges.
When you're in your office, what do you hear from constituents in terms of their concerns around mental health in the city?
Well, I would say there's some things that come along. So you'll have families, parents, especially. One thing that they talk about is sometimes their kids have very complex cases, and they're struggling to get help from the system. Sometimes people will quit their jobs because they want to take care of their kids. And then when the kids get older and bigger, that's another thing I hear about when they become teenagers or adults, and they have complex cases. They become very hard to physically manage at home. Another big thing across the province is autism, and it's very sad that many kids. It takes many years for them to get access to get an assessment and start treatment, and every year that treatment is delayed is a lost year that makes it harder to help them. And then another very tricky issue is parents who have adult children who are struggling with mental health. Addictions, and they, as a result, struggling with homelessness. And often parents feel helpless because they have adult children who, then it's harder to tell the adult children what to do if they don't want to go into treatment. So there's some discussions about involuntary treatment and what the role of that is, and should the rules change a little bit. I hear that from parents as well.
If I could jump in, because
sure.
the idea around involuntary treatment in mental health, the Mental Health Act is provincial legislation, and every province has a slightly different take in terms of the balance between the individual's liberty, the individual's right to determine their own treatment, and at what point does, and the balance and the counter to that is where the state then comes in and says, right, based on your illness and based on various variables, as a state, we will have to treat you against your will once certain criteria are met. Have you heard of discussion, at Queen's Park in terms of the Mental Health Act and if it could be perhaps strengthened?
So I know that these discussions are happening in the provincial governments in other provinces. It hasn't really hit Ontario, I would say. I think that it hasn't been a topic of discussion. It hasn't really been brought up. So I think it's just beginning in Ontario. And it has to, I think these sorts of changes begin with people, families who say, like, I'm struggling to help my adult child. And I can't. Can we change the rules? So, for example, I have a parent came in and their adult child just misses appointments, doesn't go to appointments, doesn't get treatment. And they can't force the kid to, who's 30 years old, roughly, they can't force them to go and meet their appointments or do anything else. And so they're struggling. They feel like, well, my kid isn't capable of making decisions. We're struggling with homelessness and all sorts of, it's sort of cascades, and they can't do anything. So it's those kinds of cases that are bringing up this conversation.
It has a significant impact on the carers, as you mentioned. You have families, and we receive at Summit a number of requests to assess individuals who may have potentially autism or on the autism spectrum. Unfortunately, those require fairly specialized assessments as well, in terms of ideally having a psychologist do various rating scales to determine that. When we talk about the Mental Health Act, severe enduring mental illnesses like schizophrenia, where in a number of cases, the individual lacks insight to the fact that they actually have an illness. It's one of those, it's unusual because generally when a person's unwell, they seek help. They know their breathing is labored, or they have certain aches and pains, and they therefore seek help and take treatment. Schizophrenia, in a sizable percentage, actually lack insight. They do not believe that their voices are actually a manifestation of their illness, or these beliefs that they're being chased by agencies and being hounded by, which is a product of their mental illness, that they need treatment, which is where the Mental Health Act for these individuals is extremely important. Because then, I also, in my previous life, I was a forensic psychiatrist, but still do some forensic psychiatry work. Then what happens is, when they do not get the necessary treatment through the regular mechanisms, they end up offending. Ongoing, they end up offending, and then they enter into the mental health system through the criminal justice route. So I think it is an important topic, I think, especially the Mental Health Act and involuntary detention and involuntary treatment as well. So access to care remains a major challenge. So where do you see potentially as those biggest gaps right now?
Well, let me start by saying there's a symptom that a lot of people should be aware of access to care. There are a lot more people showing up at the emergency room in hospitals who their primary problem is a mental health or addictions problem. And so I mention that because a lot of people have the experience of waiting in an emergency room or having a family member wait in an emergency room. And it's important to know that those problems are compounded. It's not the only cause, but it's compounded by the fact that there are a lot of people who are fundamentally suffering from a mental illness or an addiction. And that's evidence that the system is not working as well as it should be. Also, I had the opportunity to speak with workers at Addiction and Mental Health Services for Frontenac Livingston Hamilton. There was a labor negotiation last year, and they had informational pickets. But those are opportunities to find out, like, what are the working conditions like? And what I hear is that there just needs to be more support, and this would come from the provincial government, but more support, not only for like treatment or crisis services, but addiction and mental health services. They help people keep their jobs. They help people negotiate the criminal justice system. They help people keep their houses. So often people with mental illness or addictions, they're not capable of preventing themselves from being evicted. So living in a certain way, paying rent. And so there seem to be workforce shortages. And I would say that in the overall system, it seems that youth are particularly affected by wait times and shortages. And so the province has tried to increase funding. So you can read about places where the province, at times when the province has increased funding, but it tends to be one-time funding once in a while, and not so predictable. And if you're running an organization with staff, it really helps to know that you will have inflation increases coming, and then you can plan, and it helps you retain staff as well.
One thing I noticed so I've been in Canada, Kingston, coming up to 16 years. Now, over that period of time, one thing I notice is that when provincial governments change, it takes almost a year or so for the new government to bring in their new ideas in terms of health. They have some, they've identified a key area within the healthcare system that they feel that they need to address. I think at one point it was, people waiting in corridors and emerge, and so it takes a year for them to, bringing that new idea, and then, then at the tail end of their tenure, things either are on hold for the next election, and the cycle repeats itself. Yeah. Would it be in Queen's Park's appetite to have, I don't know if it already exists, a mental health strategy, a bipartisan mental health strategy, 5-year, 10-year strategy that regardless of which government comes in, provincial government, that strategy is implemented consistently over a period of time?
I certainly think it's possible. There is currently a mental health strategy. It's called Roadmap to Wellness.
Right.
We don't talk about it enough at Queen's Park. The government tends to say, we're spending more money on this, but we don't keep referring back to this strategy. But it does exist, Roadmap to Wellness. A good thing about it is it straddles government. So it started with the previous government of another party, and the current government has maybe done a little bit of rebranding, but it is essentially the same strategy. So it has been thought through. And I think we should be referring more to that strategy and saying, okay, how are we doing on the roadmap?
Right.
Are we progressing? I would say
funding potentially should be tied with that, because if
that's
a
right,
government strategy, then funding, wherever the funding goes, those deliverables should ideally be met within that strategy. Yeah.
So I don't think we have this timetable of deliverables which would drive the funding, because my sense from talking to people who work in the field and families who have family members who are in the system is that the funding is insufficient. And for like acute cases of addictions, homelessness, you just have to go to downtown Kingston to see that.
Yeah.
So the roadmap to wellness exists, and I think in healthcare, for example, there's one area where the government and the opposition are pretty aligned, I would say, and that's how to roll out team-based primary care. The government has this program now. They've committed to get everybody attached to a primary care in over the next, starting last year, but from now until 3 years from now.
Right.
And that effort is led by Dr. Jane Philpott, who is the dean of the medical school at Queen's. She was a Liberal MP before. And it's this team-based approach is something that we in the opposition have been saying, we should do this. And the provinces, the Ford government is more or less doing the same thing. I think what we disagree on is the level of funding. So, for example, here in Kingston, we had a proposal to open up primary care clinics, but it was only 10% funded in the first round.
Right.
So, I'm pretty confident that more funding will come, but the speed of the rollout is a bit different. This roadmap to wellness for mental health exists, and I think your point is a very good one, that it should have a timetable and deliverables, and that should drive the level of funding. It shouldn't be like, we want to spend this much on highways. So we cannot spend as much on housing or mental health. Really, I think the roadmap to wellness, maybe to put it this way, it should have more teeth. But it does straddle governments of different political parties. So that's a
process and evolution.
Yeah.
Okay. Now, long wait times, as you mentioned, and especially limited coverage for psychotherapy, these are common frustrations. As a psychiatrist providing, psychiatric care, referrals from family physicians and nurse practitioners, my services are covered by OHIP. And however, psychotherapy, not always. There are some counseling services that do provide support in the city, for example, like Resolve Counseling, but there is still a significant need for supporting individuals with psychotherapy services. So, do you know if there's anything that is being done on a provincial level?
One thing that's happening provincially, which is controversial, is that the government is, I think, with government encouragement, the College of Psychologists and Behavioral Analysts of Ontario. So their council recently passed motions to loosen the qualifications needed to practice psychotherapy in Ontario. The PhD trained psychologists are very concerned that this will affect the quality of care and could be a dangerous thing when it comes to complex cases that might be misdiagnosed. But then there are people with psychotherapy degrees at other levels who feel like they should have an increased scope of practice. So it is pretty controversial. The final decision hasn't been rendered on that. There is people all know about the shortage of family doctors, which is really, it's not so much a shortage of family doctors, it's because we have a lot of family doctors. It's family doctors who are actually practicing family medicine in the community. But in the shadow of that, we've long known about a shortage of psychiatrists. The other thing I would say that the province could do more of is the public health side. And the province, funding for public health has been eroded in the last few years. But public health has a role. Like whenever you have something that seems to be more and more prevalent in community, like mental health, youth reporting challenges with mental health, you have to go and look at what are the root causes. And that's what public health does. So they can look at social factors. How is things like connection and belonging changing, and how the social media play in isolation, adverse childhood experiences, how can we reduce that? Addictions, there are a lot of things that affect addictions. So public health has been involved very much for a long, long time in things like alcohol and tobacco, which have a big influence on health. And then public health will get involved in these social determinants like housing affordability and food insecurity. So just want to throw that in there, that I think the government could get a lot of results for a small amount of money if it said to public health, here's here's some more resources so that you can tackle some of these root causes in society.
And it takes me to a term I've used just in generally casual conversation with my colleagues and friends in terms of the triad of homelessness, addictions, and mental health. And I think, as you said,
Yeah.
when you look at the source, there, within Kingston, there's a sizable homelessness population who also have mental health issues in terms of whether it's depression or anxiety, bipolar disorder, schizophrenia, and in addition to that, an addiction concerns as well. And perhaps having a service that really is combined in that sense. So within, say, for example, housing, having mental health and addictions work within that system might provide actually more integrated level of care.
I agree. And I would say that one of the things that the city of Kingston has been doing is to try to coordinate all that care. You've got hospitals and police and treatment organizations and counseling, and all of these things need to work together. Maybe I'll just take this opportunity to say, when you mentioned the mental health and homelessness and addictions, you'll get a lot of anecdotal reports of people moving from outside of Kingston to Kingston.
Right.
Or I had the mayor of Timmins once tell me, people come to Timmins when they have mental health or addiction or homelessness problems. So because people are moving around, to me, that tells me that it's a provincial problem. The province should step in and provide the funding that currently the municipality is paying for. The other advantage of the province taking a larger role is that they can set up resources throughout the province. So particularly in rural and areas and small town, rural and remote areas. Because if somebody comes from a small town to Kingston because they're homeless or they need help or there are services here, they're leaving friends and family behind who can be a very essential source of support that doesn't come off the budget of the province or the city. And so having supports where people come from can be a very cost-effective way of meeting needs and preventing problems from getting worse. And so that's something that, for example, Kingston can't do in Smith Falls or Sharper Lake or somewhere. But the province can say, okay, we're gonna make sure that people can get some treatment where they are. I think a good example of that is in the Northwest. Thunder Bay is a big center for social services and certainly mental health and other treatment. But people are coming from all over Thunder Bay, and they're leaving their communities, their friends, their family, their natural support, which can, I think, is a very, very important component of anybody recovering.
Now, Kingston is quite unique in terms of its population, right? So we have a strong student, military members, veterans, rural communities as well. So how would these factors also shape local mental health needs?
Yeah, students is very important because we have like 20,000 students or something, and a big part of our population is post-secondary students. And post-secondary students are reporting more and more mental health challenges. And youth access and wait times is a particular sore point in our system. So one of the issues there is that university and college budgets are challenged, so it's hard for them to have the flexibility to increase services. The province has certainly provided some money specifically for mental health in post-secondary students, and the province has also required universities and colleges to have a student mental health plan and to annually produce a report on how things are going, whether it's the progress or what are they getting for the resources that go in. So these annual reports are a good thing, but it comes back to funding. The province is also, sometimes the universities and colleges can collect a little bit of extra money from student fees. Like you tack on, okay, everybody pays an extra $5 or something that will go towards mental health services. But the provincial government wants to change the rules so that these sorts of fees can become optional, and then the students could vote and not to not pay these student fees. Certainly, there's a lot of students are under financial pressure, so there's a certain incentive to, or pressure, let's say, to minimize the student fees. But that's another sore point. I think in the end it comes back to resources, and we have to realize that university colleges their budgets are strained.
Right.
When it comes to the military population, I actually don't spend a lot of time on mental health with serving military members, because they have the supports from the Department of National Defense.
Right.
And I would say that I did used to be the federal MP, and I think that the military has worked very hard in recent years to reduce the stigma associated with seeking mental health. When you feel like you have a problem, my former colleague who was a senator, Senator Romeo Dallaire, retired general, did a lot of work to go around and tell his story of how he struggled with PTSD and to encourage CAF members to not hesitate to seek help. And then the third thing I would say is Kingston has my riding, Kingston the Islands, but the city of Kingston itself has extensive rural areas, and rural areas close to cities are somewhat well served. It's the more remote rural areas where there's a challenge to get people to want to practice there, or to travel to get help.
And when setting up my own private practice here, I actually did a one-day travel through the rural communities as well, the family physicians in the rural areas of Kingston. But I found that I think the travel to Kingston for psychiatry appointments is, I don't know, I found people have traveled perhaps 45 minutes, almost to an hour to be able to be seen fairly soon in my clinic. But more rural, perhaps having teams attached to primary care within their own communities might perhaps serve a better purpose. So how can community-based and private clinics work alongside the public system, even though it's all funded publicly, to improve access without creating that inequality?
Well, I think, first of all, I think your mentioning of inequalities is really important, because in the area of, for example, counseling or something, there are wait times, and so I know that people with means will often seek a private clinic. I think there are just a couple of principles to keep in mind. And these principles, I would say, apply to other parts of the healthcare system. There's many parts of the healthcare system where public and private facilities coexist. Of course, they're all funded by OHIP. One of them is that we have to make sure one is not, the private and community-based side is not draining staff and resources from the public side. So if that's happening, then the government needs to say, oh, maybe we're not funding the public system well enough. For example, in hospitals, the use of agency nurses is a controversial topic. But when the government sees that, they should be saying, oh, maybe we should be improving salary and working conditions for the nurses, regular nurses in hospitals, so they're not tempted to go and work for an agency, and so that the hospitals don't need to hire the much more expensive agency nurses where a fee is paid to a private agency. So that's just an example of how you just have to see if people are voting with their feet and resources are shifting to the private sector, then it's not in balance. And the other principle, I think, is that it's a more general principle, not specific to mental health, just to make sure that if it's a private service where there could possibly be extra services, that there's transparency in the fees and transparency in the choices that are available to patients.
Thank you. There's some really good points. So what supports you've already alluded on the struggle post-secondary students have as well. So from your perspective, what supports do you notice are currently in place and perhaps are still needed for youth and post-secondary students struggling with mental health?
I've mentioned that the post-secondary institution itself can offer services, and that there has been funding from the provincial government. There can be an argument over whether it's been a sufficient level or not. But there are also sort of other services. So if affordability is an issue, and some students will struggle with finances, there are food security. There's a food bank. If people don't know this, there's a food bank at Queen's, for example, because some students struggle with food insecurity, and I think an important thing is the socialization. So I think anything in institutions, like if you're supporting clubs, and I feel like people can be very good at healing each other if they're together and interacting and allowing people to feel like they belong to something. They're not isolated. That can reduce,
because that can be some of the biggest challenges for students, especially those coming from out of area to university within the first or second semester, is that socialization piece. Right.
So I'm always really happy when I go to the clubs day, or they have this sidewalk sale where all sorts of different organizations, student organizations, are set up, and I think these things are really important.
So mental health crisis, we spoke about this just briefly before, overlaps with substance use and housing insecurity. So how is Kingston responding to these complex needs?
Well, I think, this is tough. The city starts out by trying to coordinate. So it has a coordination role. The hospitals, police, housing providers, crisis response, the treatment, and then counseling to help, as I said before, to help people keep their jobs, keep their homes, navigate the criminal justice system if they happen to fall into it. But the city is also working to try to find more shelter spaces. There's a need for shelter, especially, for example, during cold months. As the seasons change, some places open up, some places operate differently. And then the city's taken the initiative recently to increase the amount of transitional housing. Transitional housing is really important. It's mentioned all the time as an important part of
what does that
solution.
mean? What does transition
mean? So let's just take an example of somebody who's homeless, or maybe they live in an encampment and they're struggling with addictions. Once they get going on some kind of treatment or improvement, and they need, for example, maybe they don't need supervision all the time. They just need somebody to check in with to make sure they're continuing their good habits, and they're on their way to being independent. So this is transitional housing means they're kind of in between so crisis or shelter or whatever, and living independently.
Right.
The goal is for as many people as possible to be able to live independently. Maybe they still get some social support, like disability support or whatever, but they're independent.
Right.
They don't need somebody watching over them or checking in with them regularly. So transitional housing would be people who they're on their way to living independently, but they have somebody who checks in on them, or who's on site. They don't need 24/7 care, and they just need to move along that path. That's transitional housing. It's not the people who are in encampments and they're refusing treatment and they're dangerous.
Right.
So the city has recently bought houses scattered, and I think on purpose, scattered through different areas to kind of spread out and share the burden between different parts of the city, and they're trying to have this important step, because a lot of times people
is that what Sydenham Road is? Is that the site?
Well, there's a number of houses that the city has purchased, but there's a lot of time where people will go through treatment and then they'll relapse because they they went back to their group of friends, or they had all sorts of stress from not having a place to live, and so they went back to their addictions or their old habits. And so the traditional housing is a way for people to move, to go to a different environment, and to go to an environment where they have supports occasionally when they need it, but they're on their path to
recovery,
independent,
right,
and not so reliant on help all the time from the rest of the community.
So if we will work out Queen's Park, and we're coming to the end, what mental health initiatives and policy changes give you the most hope right now?
One thing that we can look forward to is the Financial Accountability Officer of Ontario. I got them to update their housing and homelessness report. So this is a report on so the Financial Accountability Office of Ontario, their job is to look at how the province is spending money and to say, does it look like it's being spent the way they said, and is it effective or not? So a few years ago, they put out a report on housing and homelessness, but it was using data from before the pandemic, and all sorts of things have changed since the pandemic. Things have gotten a lot worse. And so I, as an MPP, I'm allowed to contact them and say, and this idea didn't come from me, it came from a constituent. I went to them and said, look, you're using data from before the pandemic, and things have really changed since the pandemic, especially when it comes to homelessness and the encampments that are in every city in Ontario. And I think you should redo that report with new data. And they pretty easily said, yes, you have a very good point. And so they're redoing their study. They were waiting until some census data came out last year, but I'm told that early this year, the report that I asked for is going to come out. So I think now this is a little bit separated from mental health, but I think that housing is really important, and our homelessness strategy is really, really connected to how effective any strategy will be for mental health. And as we mentioned earlier, there is this roadmap to wellness which exists, and I just think we need to refer to it more often. And I really like your point that it needs to have some more concrete goals and timelines that drive funding.
Exactly.
Yeah.
Rather than a document to be referred to when it's favorable.
When it's favorable.
Right. Lastly, what message would you like to share to our Kingston residents who are struggling with access to mental health?
I'll say that you're not alone. There's a lot of people who want the mental health system to get better, and I hear from them often. And so we're trying to get the attention of the government to move more resources into the area. And there are I think one thing that heartens me is that there are so many committed people working under difficult conditions for not particularly high pay, but they just want to help people who are struggling with mental health and addictions and homelessness and everything connected with that. On a personal note, one thing that I'd like to do is to explore the connection between mental health and art. Anything that's, I think it's something it's outside of medicine, it's outside of the traditional healthcare system, but I want to know, I'm exploring, and I think, because I see some things in other countries, I want to explore what role the arts has in mental health. And I very much wonder if, when it comes to youth mental health, if more involvement in arts or maybe in sports could be a cost-effective way of reducing the prevalence of young people who are reporting issues with mental health. And we know, like, compared to when I was in school, there seems to be a lot less resources on the arts and sports in schools. Sports can be something, again, where it depends on, if you have a lot of money, of course, then your family you can participate in a lot of activities. But if you don't, you're counting on the schools, and it's. I think that we have to think carefully about whether there are these sort of non-medical things that we can do.
If I had a wish list, taking advantage of your presence as a psychiatrist and my experience over the past 15 years in Canada, approximately 10 years in the UK, It would be perhaps to have the provincial government revisit Ontario's Mental Health Act. And if there was a way, or how it could be funded, for a study to take place provincially to revisit the Mental Health Act, include all stakeholders, and produce a report to see, what changes, how should it evolve. The UK had its Mental Health Act in 1983, and then every so number of years, they also have to, make changes. So perhaps that could be how I would pitch that
All right.
to you.
Well, I will take that back to Queen's Park.
I appreciate that, and thank you very much for your time today.
Oh, it's great to be here and to have this chat.
Thank you.